we want to see the child and adult care food program improved. So if more child care organizations that are up and running and are caring for children enroll in the child and adult care food program, that gives those child care organizations more financial stability so they could perhaps weather emergency periods like this better, in addition, of course, to providing healthier food to children. It's well documented that there are many barriers to child care programs enrolling in this federal food program. There's fairly onerous documentation required. The reimbursements for food do not anywhere near cover the true costs of feeding children. So many childcare providers across the country, even though they're eligible to participate in the program and receive this financial assistance, say, this isn't worth my time. Meanwhile, if we made it easier for these programs to enroll, they would have more sound financial footing. 15% of childcare centers across the country are now saying they are not going to open up after their initial closure due to COVID. So we think it's really important to simplify the child and adult care food program, reduce the reporting burden, increase reimbursement rates for food, and get more providers on this program to give them more of a safety net in good and lean times.